Are you tired of migraines disrupting your life, leaving you in debilitating pain? Imagine a treatment that can target your migraine symptoms quickly, helping you regain control. Today, we're diving deep into Sumatriptan, a powerful medication designed to tackle acute migraine attacks head-on. Sumatriptan, pronounced Sumatriptan, is a prescription medication specifically formulated to treat acute migraine headaches. You might know it by brand names like Imitrex, Onzetra, Xsail, Zembrace, or Symtouch. It's available in various forms, including tablets, capsules, injections, and nasal sprays, offering flexibility in how it's administered. This medication belongs to a class of drugs called anti-migraine agents, specifically selective serotonin, 5-HT, receptor agonists, often referred to as triptans. Sumatriptan works by mimicking serotonin, a natural body chemical. It activates specific serotonin receptors, causing blood vessels around the brain to narrow. This action helps reduce pain signals and the sensitivity of pain receptors, effectively alleviating migraine symptoms. Sumatriptan is FDA approved for adults experiencing acute migraine headaches, with or without aura. This means it's intended for use once a migraine has already started, not as a preventative measure. For those suffering from acute cluster headaches, the injection form of Sumatriptan is also approved. It's crucial that Sumatriptan is only used after a clear diagnosis of migraine headache has been established by a doctor. It is not suitable for common tension headaches or headaches that cause loss of movement on one side of your body. If your first dose doesn't provide relief, your doctor may reevaluate your diagnosis before further use. Sumatriptan is most effective when taken at the first sign of migraine symptoms. Depending on the form, it typically starts to work within 30 minutes, with injections often providing faster relief. Always follow your doctor's instructions and the medication guide precisely. For oral tablets, take them whole with water. Do not exceed 200 mg within 24 hours. Sumatriptan injections are given subcutaneously, under the skin, using an autoinjector or a pre-filled syringe. If you use the nasal spray, it's administered into one or both nostrils, depending on the dose. Remember, Sumatriptan treats an existing headache, it won't prevent future attacks. Like all medications, Sumatriptan can cause side effects. It's important to be aware of them. Common side effects may include a feeling of pain or tightness in your chest, throat, or jaw, pressure or a heavy feeling in any part of your body, numbness or tingling, or feeling hot or cold. You might also experience dizziness, drowsiness, or weakness. If using the nasal spray, an unusual taste, pain, burning, numbness, or a runny/stuffy nose can occur. Serious side effects require immediate medical attention. Seek emergency help if you experience signs of an allergic reaction, such as hives, difficulty breathing, or swelling of your face, lips, tongue, or throat. Stop using Sumatriptan and call your doctor at once if you have severe stomach pain with bloody diarrhea, severe chest pain, shortness of breath, irregular heartbeats, or a seizure. Other serious symptoms include a severe headache with blurred vision, circulation problems in your limbs, heart attack symptoms, or signs of a stroke. One serious, though rare, side effect to be aware of is serotonin syndrome. This can occur if serotonin levels in your body become too high. Symptoms include agitation, hallucinations, fever, sweating, shivering, a fast heart rate, muscle stiffness, twitching, loss of coordination, vomiting, and diarrhea. The risk of serotonin syndrome increases if Sumatriptan is taken with other medications that affect serotonin levels. These can include certain antidepressants, like SSRIs and SNRIs, opioid medications, stimulant medicines, and some drugs for Parkinson's disease or serious infections. Always inform your doctor about all medications, supplements, and herbal products you are taking. Sumatriptan is not for everyone. You should not use Sumatriptan if you have uncontrolled high blood pressure, certain heart problems, a history of heart attack or stroke, or circulation problems that affect blood supply. It's also contraindicated if you have a heart disorder called Wolff-Parkinson-White syndrome or severe liver disease. Do not use Sumatriptan if you have taken an MAO inhibitor, such as isocarboxazid, phenelzine, or tranylcypromine, within the past 14 days, as this can lead to a dangerous drug interaction. Additionally, avoid using Sumatriptan within 24 hours before or after using any other migraine headache medicine, including other triptans or ergotamine-containing drugs. Before starting Sumatriptan, a thorough discussion with your doctor is essential. Inform them if you have any allergies to sumatriptan or its inactive ingredients. Disclose any history of heart problems, stroke, coronary artery disease, angina, or circulation issues affecting your legs, arms, stomach, intestines, or kidneys. It's also important to mention if you have liver or kidney disease, epilepsy or other seizure disorders, or high blood pressure. Discuss any risk factors for coronary artery disease, such as diabetes, menopause, smoking, being overweight, high cholesterol, or a family history of heart disease. Sumatriptan is not approved for use by anyone younger than 18 years old. If you are pregnant or planning to become pregnant, discuss this with your doctor. It is not known whether sumatriptan will harm an unborn baby. Sumatriptan can pass into breast milk. If you are breastfeeding, do not breastfeed within 12 hours after using this medicine. Any milk collected during this time should be discarded. After taking sumatriptan, avoid driving or engaging in hazardous activities until you know how the medicine affects you, as your reactions could be impaired. Always consult your healthcare provider to ensure sumatriptan is safe and appropriate for your specific health circumstances. The dosage of sumatriptan varies by form and individual response. Your doctor will determine the most appropriate dose for you. For oral tablets, initial doses typically range from 25 mg to 100 mg. A second dose may be taken at least 2 hours after the first if needed, but the maximum is 200 mg per 24 hours. For injections, the initial dose is usually one 6 mg subcutaneous injection. A second 6 mg injection can be given at least 1 hour later if there was some response, with a maximum of 12 mg in 24 hours. Nasal spray doses range from 5 mg to 20 mg into one nostril, or 10 mg split between both. A second dose can be taken at least 2 hours later, with a maximum of 40 mg per 24 hours. It's important to note that the safety of treating more than 4 headaches in a 30-day period has not been established for any form of sumatriptan. If your symptoms don't improve or you experience frequent headaches, contact your doctor. Beyond MAO inhibitors and other migraine medications, be cautious with other drugs. As mentioned, many medications can increase the risk of serotonin syndrome when combined with sumatriptan. This includes certain antidepressants, medications for Parkinson's disease, serious infections, stimulants, opioids, and anti-nausea drugs. Always provide your doctor and pharmacist with a complete list of all prescription and over-the-counter medicines, vitamins, and herbal products you use. This helps them identify potential interactions and ensure your safety.